hated my teeth. I hated looking in the mirror. It was just awful. As long as I kept my mouth shut and I looked in the mirror, I'd be fine. In school, when I was younger, I was always made fun of for having a gap.
Her case was a little more difficult than just a small space. When you're fixing such a large space, you know, you have to adjust the teeth size so that they still look natural. In her particular case, we opted to go with crowns, and the crowns are prepared, the teeth are prepared in order to fit a crown. They have to be taken down just a little bit so that you can actually physically put a crown on top of them. She came in for her first visit under local anesthesia, was numbed up, and just had to prepare her teeth, put temporaries on, which are made out of a resin, which are almost like plastic. When they took impressions, we send that to the lab. It's going to take 2 to 4 weeks. And during that time, she's wearing resin plastic temporaries, which some doctors will say, you know, if you make their temporaries look bad, well, then they'll be sure to come back and get their crowns in. But, you know, we want to make those look good too. So we made her some good-looking temporaries made out of resin. They feel sort of like plastic while the lab's making her porcelain crowns. And then when the porcelain crowns come back, we had her come back, cement those in, and then we did some bonding on the lower teeth, which is just white filling material to fill in some of the spaces there, because those spaces were small enough that a little bit of bonding was okay. For some people, it's a life-changing experience. It totally changes how they look at themselves, how they dress. They smile more, you know, they're just happier. It's amazing how much different that they feel about themselves, and something that is really now pretty straightforward, easy. There's nothing too complicated about today's, you know, aesthetic dentistry. It's just learning some of the processes and learning how to do some of the things.
It ain't hard, I mean, it's not like real painful or nothing. It's just laying in a chair.